I have a really special guest today, and I know there's so many people anxious to see this broadcast. It's been a buzz all week, so people have been waiting to hear from you. I have Gail Tully with spinningbabies.com. So anybody that's ever had a breech baby has probably been on her website. So I want to introduce Gail. Gail, say hi to everybody.
Hi, everybody. I'm so glad to be here with you.
So just a little background. You've been doing the Spinning Babies website for what, how many years? 12?
Well, it's 2019, and I started the website approximately 2001.
Oh, has it been that long? Okay.
Yeah, 18 years.
Wow, that's a long time.
It was very tiny in those days.
Yeah, I mean, were websites even around back then? I can't even remember.
Yeah, that's the 90s, but it wasn't. It was innovative. One of the fathers who had a VBAC baby at home, they had 4 cesareans, and now they had their first vaginal birth at home.
Oh, wow. And is that what started this whole thing, or what started the website?
Yeah, the website was to share information that people were looking for. I just thought I'd put some ideas up. I had been a midwife and a doula trainer and activist in Minneapolis. We helped nonprofit organizations get doula training. I got to be part of the county hospital doula program. We brought in the doula program. And I had a question, how to help posterior babies, how to help people have easier births with posterior babies. And I thought I'd put together a little afternoon workshop with my peers, the doulas and midwives of Minneapolis, and see if they thought that I was making any sense. I wanted their opinion because I was writing a book.
Oh, okay.
And which I haven't written yet because I found out there was so much to learn. And now I'm so busy doing these workshops, which took off like wildfire. And now we have 5 trainers, and we have another 9, 10 coming in.
Oh, wow.
So we'll have 15 trainers as of August this year. It'll be wonderful.
I mean, just seeing you grow from a website, we were talking earlier, I remember her early website was just so, I don't even know if the letters all lined up with each other, but now it's beautiful. It's really cool.
Yeah, thank you. And we're interviewing website designers right now, so it's exciting to go. It's exciting to grow and stay with the new birthing generation. What are their needs?
Right. So let's talk about what you wanted to talk about today. You were saying that it's more than just about the babies head down, the spinning babies. Why don't you talk a little bit about that?
Thanks, Nancy. When women hear that their babies are head down, there's such a feeling of relief. And then there's some confusion later sometimes for some people that expected a natural birth, and they have found out that, hey, my baby's head down. I heard that my baby was in a good position. Now my labor's not starting, or it's starting and stopping, or it's taking longer than expected. I expected a nice natural birth, perhaps, or at least a straightforward one. I wanted if I was taking pain medication, I wanted it to work for me and not against me. These questions of why me? Why is my labor longer and more different than my friends or my neighbors? And I started to ask that question, what is that? And I found out it's more than head down. It's the angle of the baby's head in relation to the pelvis. This 3-dimensional puzzle piece of the longer head into the pelvis that's long in one direction but not the other direction, and they have to line up together.
Yes, that's true.
Yeah. And more than lining up, people think about it. Okay, if the ball and the basketball hoop are not they're not both round, then I'm turning. And that's not what spinning babies is about at all. It's about this duo of birth giver and baby, and the dynamic interactions between the two, which are based on connective tissue, muscles, and ligaments. Not very much the bone, the bony pelvis. The alignment of the bony pelvis, yes. The mobility and stability, yes. But not the size. This whole thing of so many people having too small pelvises for the babies. You and I know that's not particularly true. It can be, but it's rare.
Yeah. Very rare. Yeah. That pelvis does amazing things when a baby comes out of it.
Ooh,
Yeah.
all right. Ooh, let's move out of the way. Why would this amazing feat of nature be different for humans than the rest of the world, the rest of the animal kingdom? It's not. Our bodies are awesome.
I know, right? Yeah, and if those muscles and the ligaments, mainly, the muscles, if they're restricted in there, that pelvis is not going to expand like it should, or even equally. So I know I told Mom, we're trying to get you balanced.
Yeah, and you use the word balance, and you talk about muscles being restricted.
Yeah.
Tell us what would cause the muscles to be restricted.
Oh, a lot of things. It's, even in my profession, as a chiropractor, I use one side a lot. So repetitive motion, so that will tighten up my psoas. And, so it's repetitive motion, it's posture, it's subluxation, the bones being locked up. It's so many things. There, scar tissue from previous, issues. Things like that. Yeah.
I say balance is not too tight, not too loose, and not too twisty.
Yeah.
And if we could untwist the cervical ligaments, and once we take something that's tight, I mean, we're not taking it. Excuse me.
Yeah.
Once we create the environment and create the stretch or jiggle to let that muscle relax, then its partner muscle also comes into balance very often.
Yeah.
Spinning babies has been a receptacle of ideas, successful traditional techniques, and modern innovation, body work, understanding the soft tissues. And now we have sports science, physical therapy science, new science on the fascia that just really has been coming out since 2017, and a little bit before that, but it's just really coming out now, that validates those traditional techniques.
Yes.
Getting part of the body jiggling, like the many areas of the world have done that, or a slow, steady stretch like Dr. Carol Phillips' sideline release that you mentioned before we got on.
Yeah. I was telling Gail that I did my training under Carol when I did my diplomate in pediatrics. She was my instructor who taught me all the myofascial work, the body work from pregnant women. We started with pregnancy, and then we moved to babies. So we do, a little more than just Webster sometimes on, it just depends on the mom and what we find, but sometimes we throw in the myofascial work too, a lot of times, to help with.
Dr. Carroll's work has evolved so much. I'm taking her weekend 3, which is the pregnancy weekend, for the 5th time this June, just to hang out with her and our friends, and it's in my town.
Yeah, I was gonna say she's up there where you are, right? Yeah.
Yeah, this will be the 5th time taking that particular workshop since I first learned about it. That the baby who I came with a pregnant woman, she needed a pregnant model, and she invited me to come, and I hung out for the whole weekend, our pregnant model only for a couple hours, but that baby is, graduated from high school now.
Yeah, she's been doing it a little while.
Yeah. Oh, so yeah. She was well into it then.
Yeah, she's probably even adapted the technique a little bit too, I'm sure.
Oh, yeah. It's significantly evolved. Yeah.
Yeah. And maybe I'll have to go through.
Yeah, come. It's in June.
I may do that. We'll see.
So we talked about balance. How can parents do this themselves? as I was saying, Spinning Babies is this receptacle. So parents and providers can go to the website, spinningbabies.com, and see a list of what are daily activities to help a full range of motion. When a pregnant person goes to a chiropractor and then comes home again, they can use these daily activities to support the balance the chiropractor is providing for them.
Yes.
You know, it really goes well together.
It really does. In fact, a lot of the moms I see will have already been to Spinning Babies before they come in. So it's great. Yeah.
Because they're really looking for, what can I do? I've been given a diagnosis of a cesarean.
Yeah.
You know, first of all, some breech babies are totally normal in that position. They're all curled up in the smallest diameters, coming down from the right side typically, but even sometimes from the left. They're going to just slip down, slip out, spiral out. But we've lost the skills to support them for those few that sometimes get hung up on a bone, you know.
Right.
And simply that can be turning the part of the baby that's caught on the bone into the part of the pelvis that has so much room.
Yeah. Yeah.
You know, it's like here there's no room, right next to it there's a lot of room. But we've lost those skills, so these babies are at risk from natural birth until we bring those skills back. We're going to have a breech conference in November in Madison, Wisconsin, and there's a lot of activism to bring the skills back around the world, but particularly coming out of Germany and England, so it's exciting.
That is really very exciting, because they're not even, you know, the schools aren't even teaching that stuff anymore. Sorry, something's falling down here.
The upright breech skills show tremendously improved outcomes for breech babies, tremendously improved, so that the fear about breech birth isn't even relevant when the parent's on their hands and knees. Giving birth on hands and knees, the baby is so much safer, but we still need to have the skills, because sometimes they do need to have help being moved. The maneuvers are the same for the cesarean as they are for the vaginal birth. So if the obstetrician is skilled at how they bring a baby out of a tiny cut in the abdomen, which doesn't look so tiny afterwards, but during the birth process, it is the smallest cut, you know, possible to bring the baby out. And they have to turn the baby this way and that way, like a button through a buttonhole.
Oh, yeah.
It's like putting a button through a buttonhole. You know, you have to twist that button. And it's the same skills. It's just not the same cultural support for natural birth.
Right, right.
So parents are using Spinning Babies techniques intensively. Let's say, I think 34 weeks is ideal for breech babies to turn head down. Yeah. Anytime working with the soft tissues, anytime in pregnancy. I hope they're going to the chiropractor throughout pregnancy. But let's say taking a week of intense activities for soft tissue is perfect sometime between 30 and 34 weeks. 34 weeks seems key for professional help. By 36 weeks, when parents are taught to pay attention to if the baby's head down or not, the baby has less room. And for some people, that's an issue. And for other people, it's not. When people are helping what's too tight and what's too loose get into balance, the babies often turn themselves head down. That's the goal of Spinning Babies, is the baby can do it themselves. But if this person goes to a doctor to have the doctor move the baby head down, called external cephalic version, then if they prepare to take out what's too tight by doing some of these exercises to get that muscle more fluid, then the baby can go head down and stay head down.
Right.
But if you imagine a tight rubber band and the baby's head is next to a muscle that's like a tight rubber band, and you know, the doctor turns the baby's head into the tight rubber band, what's going to happen is that boing, the baby goes back head up.
Right.
So let's relieve that tension so the baby can say, thank you, now I have the room. It works really well. I'm hearing from nurses and doctors and midwives around the world that are intensively doing these exercises forward leaning inversion, sideline release, the jiggle, things that we've learned and you've learned and I have. And they're finding increased success, not 100% success,
Right.
but dramatically increased success.
Yes, it really makes a difference with the muscles, you know, to get them balanced. And your website provides those tools for these moms, which is wonderful. You know, it's much appreciated in the birthing world.
Thank you.
I have to show you my little chart I put up here.
Oh,
If you can.
let's see, baby head down. Oh, look at you go with the Webster technique. And I love the Webster technique.
Yes.
And you're helping the round ligaments as well, aren't you?
Yes. Yep. We work back and front. Just to get the balance, you know, the pelvis balance. That's what it's all about.
Yeah. Yeah. For people that don't know, the round ligaments are two round ligaments. Think of two pencils, vertical, in the front of the uterus. If they're tight, they're like a pencil. If they're loose, they're really flexible.
Yeah.
But they get tight, and that when the midwife or the doctor feels for how is the baby in the womb, and if that ligament is tight, it feels like a zing. Ah, what are you grabbing down there? If you roll over, it can be quite a stitching pain occasionally. Not every day, but you know, a couple of times a week for some people.
Right.
And your ability to relieve those muscles, or that there's little tiny muscles inside that ligament, your ability to let that ligament relax, then the baby can say, oh, thank you. Now I can get past that speed bump.
Yeah. Yeah.
Get my head down.
Yeah. Yeah. It's all about providing the environment for the baby to do what it's going to do naturally. You know, that's the whole goal.
Hallelujah. Yeah. That's it. That's it.
Well, Gail, before we sign off today, do you have any tips for any of our moms out there that are pregnant?
My tip would be just love life, love your baby inside. Don't take anybody else's limited view seriously. Find a yes in all of life's adventures. You're welcome to come to the Spinning Babies website and explore. Get a cup of tea. It's going to take a while. It's a massive website. But start with the pregnancy drop-down tab, and you'll find daily activities, weekly activities, which you can do more than weekly. And, you know, and professional help, you hear about chiropractors and the benefits of chiropractic care. You can find out about fascia care.
That's
Life's
awesome.
waiting for you, and we're so grateful that you're bringing life to us with this little baby inside.
Yeah, it's such a joy. We have at our South office, I just found this out the other day. I see how disconnected I am. We do have an instructor, a Spinning Babies instructor that does workshops once a month down there. So she said she was going to be on. I don't see her posting yet, so she'll probably watch the rewind of this. But she does do at our other office. She's doing something with Spinning Babies.
We have Spinning Babies aware practitioners, and we have Spinning Babies certified parent educators now.
I think that's what she is.
She's a Spinning Babies parent educator. So parents, if they have the ability to be near one, are in small classes of like 5 pregnant people, couples, and then you go through these exercises, the rebozo montiata, sifting of the belly, the forward leaning inversion, sideline release, and learn what you can do. It works really well with chiropractic, and it works really good. Some people are off in the middle of Alaska. They don't have a chance to go to a chiropractor. So here's some self-care.
That's awesome. Well, thank you so much for joining us. I really, really appreciate it. And if you see Carol before I do, tell her I said hi.
I will, Nancy. And thank you so much for having me here. I hope to do this again.
Yes.
You're just lovely.
Great. Thank you so much.
World. In Indianapolis. Yay.
Yay.
Have a great day.